Hello and welcome to Authentic Podcast again this week. And I've got with me a very interesting guest. But before I do, if you are new to this program, my name is Abia Sonia. Authentic Podcast is about discussing issues that will potentially affect our mental health. So we draw awareness, talk about family, talk about finance, talk about different things. So today I'm going to allow my guests introduce herself because I don't think I'll be able to introduce her properly if I try to. So thank you so much, Olamide, for accepting to speak to us today. Please, can you introduce yourself?
Thank you. So, as you said, my name is Olamide Shalanke. I initially trained as a nurse, but I've been working as a midwife for over 15 years, clinically. And in the past 5 to 6 years, I've been working mainly in higher education. I'm currently a senior lecturer at a university in the East Midlands. And I dabble in different things. I would say that my area of specialist would be providing care to mothers and neonates with additional care concerns, as well as universal care needs. So that just means basically um, any pregnant woman and any newborn with normal needs, universal care needs, and additional care needs. And I do other things as well. Um, as I said, I work in a university, so a lot to do with education, reducing disparities within the education system, and reducing disparities and raising awareness about inequities for women of certain ethnicities in the UK. So that's a bit about me.
Fantastic. You can already tell the reason why I invited her. She's multifaceted, as in she is really good at what she does. I invited you to come and speak because when I listened to you speak, the passion that you have for what you do was just so glaring. So please, in terms of, I know a lot of things, once a woman is pregnant, a lot of things happen. The woman wants to ensure that the baby is well, she herself is well, but there are so many things that hinders us as a result of our cultural belief, our religious belief, and things like that. So would you like to speak more on when a woman, an African woman precisely, or a woman from ethnic minority is pregnant, what are the things that you have noticed that they do not prioritize, but they should prioritize?
Okay, so women of our ethnicity, we have this perception about the strong Black woman. So this perception means that we do a lot of things that we should not be doing. There's
Mm.
a lot of literature out there. So for anyone interested, I would say literally type in that term into the internet and see what comes up. So over decades, over centuries, we've been conditioned to believe in this stereotype of the strong Black woman, and we believe that this is a good thing. It's a coping mechanism. When you're strong, you can go, leave work, go and bear the babies, have the baby, get straight back into work, being a housewife, being mother. And it's something that is constantly perpetuated and we support it. But
Mm.
actually, that's a maladaptive coping mechanism. It is a poor coping mechanism because that as a result of the strong Black woman stereotype, we continue to do things that we shouldn't do. So in essence, for example, what we tend to see in the maternal side, we see a woman, maybe she's having pains in the antenatal period,
Yeah.
maybe she's having calf pain or she's having headaches, but because of this coping mechanism, we think, oh, I don't need to tell anyone, I just need to be strong, I just need to be, to bear the pain. But
Mm.
what that woman does not realize is might be a warning sign for pre-eclampsia, which
Yeah.
is a which is a big obstetric emergency. But because we've been conditioned to think that it's normal, you just have to get on with it, we ignore it. It could be signs of a blood clot, which is prevalent in pregnancy.
Mm.
Let's say, for example, this woman goes to give birth. Um, we know the labor is painful. We
Mm.
know, it's painful. It is contractions. It is your muscles contracting and retracting. But in the same manner, because of the strong Black woman stereotype, we think we don't need to have pain relief. So women suffer unnecessarily through labor. From a healthcare perspective, from a clinician's perspective, pain is not normal.
Mhm.
Pain is a warning. that there's something wrong.
Mm-hmm.
So if as a Black woman, you go into these scenarios and you think, I have to hold the pain, I must not show the pain because I'm a strong Black
Mm-hmm.
woman,
Yeah.
you're not helping us clinically, because
Yeah.
pain is an abnormal sign that something is wrong. So
Yeah.
if you are not showing your pain, we think everything is normal. That pain could be a sign of bleeding. It could be a sign of placenta abruption, that the placenta has come away. But once again, if women hold this pain, we don't know that there is something wrong. So that's one of the ways that I mean it's a maladaptive coping mechanism. We need women to let us know when they're in pain. There's a lot of reports and there's a lot of research that shows that Black women, Asian women in the UK, they have poor experiences of childcare. They do
Mm.
not access pain relief. So there's research and literature to back this up as well. You mentioned mental health. Once a baby is then born, so we've talked a little bit about antenatal care, the period,
Yes.
and the labor
Yes.
postpartum period. So once the baby is born, there's a lot of changes that happens. There's
Mm.
a lot of hormonal changes the woman has to go through in the body. There's a lot of clinical physiological changes. And what literature has shown us is that this is a time when women are more likely to be affected negatively with their mental health. So
Mm.
in UK, in obstetrics and in maternity, we track what are the biggest concerns that we have to focus on. So the past reports, it's called the Embrace report. So the Embrace report in the past year, it lists the 5 main emergencies that we have to be concerned about, one of which is poor perinatal mental health.
Mm.
In the past, we used to call it the baby blues, or pregnant, poor mental health in pregnancy, or antenatal depression. But because we recognize it can happen at any point during pregnancy, or following pregnancy, we call it perinatal mental health. So
Yeah.
what's happening in the United Kingdom now is that poor perinatal mental health is a high contributory factor to maternal death. Women are dying because of poor mental health, and it's
Wow.
one of the top 5 killers in the UK. So let's bring back this phenomenon, which is a strong Black woman. So
Mm.
you've managed to get through the antenatal period. You had pain. You didn't tell anyone, but we managed. We went through labor. Now we're in the postnatal period. So you have a woman who is juggling physiological changes in her
Mm.
body, juggling baby.
Mm.
They may have African Asian home. You have a partner that you're caring for. You might have extended family members that you're caring for. There is a high chance that your mental health may be affected as well.
Yeah.
But for the strong Black woman, which we already said is a poor coping mechanism, you don't speak up. You don't
Mm.
tell anyone because you believe you just have to get on with it. You
Yes.
don't tell anyone. The danger is that this is actually a chance, this is a risk for mortality. It's one of the top 5 killers in the
Mm.
UK. So in the postpartum period, we say up to sort of a year following the report I mentioned earlier, the Embrace report, it looks at women that have died, why they've died, and it looks up to 1 year postpartum. So
Yeah.
as I mentioned, poor perinatal mental health was one of the top 5 killers. About 188 women died.
Mm.
And I think about 2/3 of them died due to suicide. So they took their
Oh,
own lives
Lord.
because of poor mental health. So that strong Black woman, you need to let the clinician know when there's a problem. You're not expected to be perfect. You're not expected to be able to juggle everything. But because women don't speak up, then we have women that are taking their lives. There's just so much to it. But to kind of sum up the question that you've asked me,
Yeah.
the strong Black woman, it is a poor coping mechanism that is causing death. As clinicians, we need to know when something deviates from normality.
Mm-hmm.
Pain is one of the ways in which we know that something is not normal. So
Yeah.
if the Black woman, the Asian woman, is holding their aim, thinking they have to be strong, and they do not tell us when they're in pain, we've already missed the first sign.
Mm.
When it comes to mental health in pregnancy, we know it's one of the biggest killers. So we need women to speak to us.
Yeah.
We can talk more about how we identify poor mental health in pregnancy. Sometimes it's obvious, sometimes it's not obvious, but we need women to trust more in the system and to speak to us and seek help when they
Yeah.
notice deviations from normality, when they notice they're not doing things they usually do, they're not enjoying life how they used to,
Hmm.
they're not sleeping well, they're not eating well, they don't want to hold the baby.
Yeah.
These are abnormalities, and they need to tell us, because the earlier we know, the quicker we can do something.
Yeah.
Just like every condition, poor mental health has stages. You
Hmm.
may have the baby blues, you may have a bit of anxiety,
Yeah.
depression, but at its worst, it could become quite serious. It could
Hmm.
result in postpartum psychosis. It could result in the numbers I talked about: women abusing substances, women dying from suicide. So the earlier we know, the earlier we can do something as clinicians.
Wow, I told you she's so passionate about what she does. You've said so many things. I'm just gonna try and unpick it. There are so many women, especially Black women, they have high pain threshold, very high pain threshold. These are the women that will be in labor, they will not cry. These are the women that will be in labor. They will be walking around and you wouldn't know that they're in labor because their pain threshold is really high. And now you're telling us that pain is an abnormality. But some people like that, they see it as a discomfort at the least. They don't see it as like it's just a discomfort. So I'll put up with it. So you're trying to tell us now that that's a danger because when we are saying the earth people, people in the health sector, they are not taking us seriously because we are not presenting right to them. That's what I heard you say.
Correct. Correct.
Wow.
Now, I'm not saying it's okay to have a high pain threshold. There is something we can call like normal pain and abnormal pain. Say, as a pregnant woman, you come to me and you tell me you have a headache.
Mhm.
If I give you pain relief, I expect that headache to be reduced in terms of the pain intensity. If it is not reduced, then I know that this could be a sign of something else,
Yeah.
pre-eclampsia, for example. But if you feel I have a high pain threshold, it's okay. I will hold the pain.
Yeah.
How, as a clinician, can I know what is normal or abnormal if you're holding the pain? So it's okay to have the high pain threshold, but communication and empowerment is one thing that I want to do more with our society and our communities, to
Please
empower
do.
people to know what is normal and abnormal and to speak up more.
Yeah. Yeah. So for listener out there, this is very important. I'm gonna sit here a bit. It doesn't matter whether your threshold of pain is high.
Mm-mm.
Just speak up. Because she said it now, pain is a message, is an information. And if you do not communicate that information, the earth people, they are not psychic. They are not
No.
mind readers. They cannot read your mind. So you need to tell them. And there's no such thing as that you're complaining too much. It doesn't matter. Let it be the one to decide that. It's very, very important that you advocate for yourself and you speak up. And there is no talk that is too much. There is nothing that just keep repeating it. Repetition is how we learn. You tell, let's say for example, someone is attending to you, you tell her, and then the next person you tell them, the next person you tell them. Then they are just gonna maybe they'll go and they're talking to one another. Oh, she told me she's got headache, and then the other one she told me she's got stomach pain, and collecting and say, oh, this is not right. So they can easily see to you. So it is so important that you just say it the way it is and don't
Yeah.
feel like you're disturbing anybody because that's what they are there for. They see
100%.
you that you are
Yeah.
disturbing them. It's very important that we speak up.
And it's your life. So
Yeah.
you have to advocate. Who's the best advocate for yourself if not you? Now, I'm not, I mean, there's a lot of issues with the health system. So I'm not saying the health system is perfect. It may be that you speak to someone and you don't feel heard. We can talk about that as well. There are channels that you can go through.
Mhm.
The book doesn't stop with someone. So if you were to
Yeah.
speak to someone
Yeah.
and you feel like you're not being heard, you can speak to someone else. There is always someone else that you can speak to. So it's
Yeah.
escalation. If you give someone a message, I have this concern, there's something wrong,
Yeah.
you should expect a response. So you should say to them, what should I expect to hear back? Or what are my expectations? If they don't meet that expectation, then you know you need to escalate at a given time.
But Olamide, when a woman is having a baby, the process is quite fast.
It can be.
How do we then do that? Because that escalation time, there might not be time for that. So how do
Okay,
we
so that's
do
a
that?
great question. So really, that's something that should be done before. Unfortunately, it doesn't always happen in our communities. So when a woman is about 34, 36 weeks pregnant, they
Mhm.
will usually see the midwife if they're having universal care in the community. If they're having additional care, they may see an obstetrician in the hospital as well as a midwife. So between that 34, 36 weeks, there's a conversation that needs to be had. That conversation needs to be around the choice. the environment of birth. So where do you want to birth your baby? Am I having the baby at home, in the hospital? Am I having the baby on the midwifery led unit or in the obstetrician unit? How do I want my birth? So essentially, it is at this 36-week period. This is when a woman and a partner makes up the birthing plan.
Mm.
So it's not when you get to the hospital that you start talking about this is the pain relief that I want, because as you said, there is no time sometimes.
Yeah.
At times you don't have that luxury of time. So this conversation needs to be had before. And usually, so we have certain guidelines that we work to as clinicians and midwives.
Yes.
So the antenatal guideline that we work towards, it says that at 36 weeks thereabouts, this is when we have these conversations about a birthing plan. So that's
Who initiate this discussion, the midwife or you?
so it should be the midwife that initiates the conversation. But if the midwife does it, where we talk about empowerment, know what you are entitled to and advocate for yourself. So the
Yeah.
midwife should initiate the conversation. But if they don't, then of course, the most important person here is the woman and the
Yes.
baby. So you have to have that information to, to advocate for yourself.
Okay, Olamide, I'm going to publicly
So it's
rope you
this
into
30,
something right now. I'm going to publicly just rope you into this. Can you
go
just
ahead.
kindly
Go ahead.
do some snippet of things? Sometimes we think there's certain information that is universal or common knowledge, but it's not. Is it possible for you
Mhm.
to do like a snippet, even if it's just 5 minutes, 3 minutes of things you should know as a woman from birth to giving birth? Is it possible for you to do something like that for us? Maybe on YouTube or maybe on your social media. And I know you're a very busy woman, but is it possible for you to just do that snippet ever so often and just drop it so that at least we
I
can
could do.
signpost, you know, people to that to
Yeah.
that to that
Yes, I could do.
information?
And
Because it's so
yes, I could do
important.
because it is really important. And like I could work with you in terms of, okay, what do we want? Because I mean, there is so much, but we could work together. Like, what do you want me to focus on? We could have a series. But one
Yeah.
of the, I mean, thinking just right on my feet now, one of the things I would say before, when you're about that, either a midwife or an obstetrician, about what your birth should look like. So what I'm saying is have a birth plan.
Mm.
Now there's a slight caveat to that, a slight asterisk. The best planned births don't go as planned.
Yes.
So you have to be flexible. So I'm not
Yeah.
saying make a plan and you're going to stick to the plan like, okay, this is what I'm doing. No, you have to be flexible based on what's
Yeah.
going on at the time. But one of the things you should do before going into labor is make a plan. What is labor going to look like? Do I want to have the injection to birth the placenta? Do I want to have oxytocin? Do I want to have epidural? What options for pain relief are there? What position do I want to be? So women can start to think around this. What is a birth plan? Go on the internet, do some research, speak to your midwife. So I'll leave us with that for now, and then we can talk about what other information we may want to share, maybe in a series, etc.
Yeah, I think that will be really good. I'm going to hold you accountable to it. Thank you so
That's
much
fine. I'll be
for
up
even
for it.
yielding to that. Yeah.
Of course.
Okay. This episode is sponsored by ASEP Consultancy, a home of personal transformation for the mind, body, and soul. If you are ready to rise above burnouts, move away from depression, heal anxiety, break free from traumatic emotional pain, and live with confidence, in order for you to gain clarity, for you to move from surviving to thriving, why don't you visit our website www.asebconsultancy.com. We'll support you through counseling, life coaching, and other trauma recovery programs, grief courses, and we even offer one at a time therapy. All of these services is available virtually, so you do not even have any excuse of saying you do not want to leave your home. You have everything from the comfort of your home. Will support you to move from surviving to thriving. Before you go, have you subscribed yet? Like, share, and comment on what resonates with you so far on this episode. If you have not done so, why don't you just click that button now? Thank you. Back to the program now. Okay, so when you were talking, you mentioned 4 stages, and you said something about
Yes.
postnatal psychosis. Can you run us through those stages, the signs that people should watch out for? the possible
Okay.
symptoms.
I'm really, really passionate about perinatal mental health, and it's because I know people that have been affected by it. Okay, so not that there are stages per se, but what I mean is that you could have mild, you could have moderate, or it could be quite severe.
Hmm.
So, what should happen is in the postpartum period, every time a woman sees the midwife should ask questions about their well being. So, we
Mm.
talk about things from a holistic perspective. For
Yeah.
example, they'll say, how is the breastfeeding going? They may check your blood pressure. Those are physical signs.
Yes.
But then they should also ask questions about your mental well being.
Mm.
Questions like, are you sleeping well? Are you eating well? I'm not saying that this always happens. So sometimes the midwife might not ask that question. Okay. What are some warning signs is what you asked me for. Sometimes we know when we're not ourselves, but it's more difficult when we don't know. When
Yeah.
you've just had a baby, there's a lot of changes. The warning signs I would be saying to my patient, or I would be saying to someone to look out for, is sleep is really important.
Yeah.
It is difficult to sleep when you've got a newborn,
Mm.
but how much are you sleeping? Because that is one of the first signs. If you manage to enough sleep to cope, okay. Of course,
Mm.
not getting any sleep, that could be one of the first things that starts to tip you over mentally.
Yeah.
Sleep. The next thing I would say is food. How
Mm.
well are you eating? Are you managing to have any meals? Because usually, I mean, holistically, these things they do interlink with each other.
Yeah.
By the time your mental well-being goes, it may be that you've been suffering physically for a while.
Hmm.
I mean, in my brain, in my head, it all makes sense. You just had a baby, you're anemic already, you've got less oxygen carrying ability in your body, you're more likely to be tired.
Yeah.
Then you're not sleeping, then you're not eating. It's only a matter of time before it affects your well-being, your mental
Mm.
well-being. So a woman that's really not getting enough sleep, it's not going to be like before, but
Mm.
if the sleep is quite severe, that's a warning sign. Not eating as
Yeah.
they usually do. Someone that doesn't want to hold the baby as much, I would
Mm.
say, is maybe something I'd be looking out for as well. And
Yeah.
this is where we also depend on the partners, on the husbands and the family members. Like, have you noticed these things in the woman? Someone who they're not holding the baby, they don't seem to want to interact with the baby.
Yes.
Another thing which might sound a bit odd is going into a home for the first time. Say I'm a community midwife and I'm going in to do a postpartum, a postnatal check, and the
Yeah.
house looks absolutely perfect. I would be that would make me want to ask questions, because if the house looks perfect and you don't have a maid or a leave-in nanny, how are you sleeping? How are you eating? Caring for the newborn, and the house looks absolutely perfect. That
Mm.
means that something is lacking somewhere. It could be
Yeah.
because you're not sleeping, you're not eating, and you're focusing all your energy there.
Yeah.
Um, those are some things I might look out for. Then there's the more obvious signs. If a woman is saying to you that she feels anxious, she feels very tearful, and
Hmm.
it's not going away, she feels like she
Yeah.
doesn't enjoy anything, these are warning signs as well.
Wow.
Uh, These are textbook things I'm saying. So it may be different in this, in the actual situation, but a woman that also, you have to give people the chance to speak.
Yes.
So if you ask closed questions, are you okay? They're going to say, I'm okay. Are you
Yeah.
fine? Are you all right? I'm fine. But if you give people the chance to speak up as well,
Mm.
so how are you feeling? What's
Yeah.
going on? Tell me how your day has been. So that's another way you can get information
So
about that
open
person,
questions.
open questions about that person's well-being. Yes.
Yeah. Okay. That's absolutely fantastic. Um, I remember when I had my first child, that was the first time I was burned out. I
Mm,
experienced what is called burnout. Just like you described, I was not sleeping well. But then I would say I was even doing too much. My mom was around. I was supposed to let her look after that child. But I was like an oak, just hovering around her. When she's sleeping, I want to check that she's okay. I think, in reflection, I think I was scared of cut death as well. Because when we
mm,
went for the training, they told us about cut death, make sure nothing, the airway is clear. So when
yeah.
she's sleeping, I'm looking, hope she's not rolled to a funny side and all of that stuff. So when she's sleeping, I'm supposed to be catching up on sleep. I wasn't. And
Mm,
the sleep, the lack of sleep was building up and building up. And one night I woke up with hives. I was itching like mad from my head to my feet. So when different part is itching, I took a brush. I was crushing my
Mm.
skin, and even though it was bleeding, I did not. I was so oblivious of it. I was just crushing everywhere. I was crying because my mom was around. You know, African mothers, spiritually, they have come.
There
She
was
started
something.
praying. She started praying and
But
all of
that
this
lack of sleep,
stuff.
how
Yeah.
the mental well-being and the physical sort of link
Exactly.
together.
Yeah. So in the end, it disappear. You know the way eyes behave, it disappear. So in the morning, while I'm going to see the GP, I have no evidence to show them. All that was
Mm.
left was the comb
The mark, the inflammation from
marks on my body.
scratching.
Exactly. And it's like, what is this? I didn't know. So one day it happened several times. And then one day I just thought, no, I told my mom, get a camera because phone did not
Yeah.
have. It's not like now where you have phone. That's like 18 years ago. It is not like now where you have phones everywhere and all of this stuff. I told my mom to use the Kodak phone, Kodak camera in the
To
room,
capture it.
take the picture and take a
By the
picture.
time you develop the film.
I took the camera itself to the GP and I said, this is what I've been trying to describe. He said, "Oh, this is high, Sonia. Oh, he said, you are tired. He said, your stress level is high. And
Yeah.
this is why your body is coming up with this. So the
It's like
body was
it's the
speaking, shouting.
inflammation, you
Yeah.
know.
It was creamy. So that was when I knew that I was toasted. I need to take a step back and to make it worse, I can't sleep in the afternoon. I have to sleep inside it. So I have to reset my brain, like, help yourself, this woman. Even if I'm
We
not
have
sleeping, I
to.
just lie down there. And sometimes I end up catching a bit of nap here and there. And I started helping myself. But I was really, really tired. And I was anemic as well. My
See
iron
what I
level
said?
was really low all through the pregnancy. So it was really, really bad. But one thing I had to communicate with them often that when I wake up, I'm feeling really lightheaded, like I'm going to pass out. And I constantly was giving them feedback as to how I was
Mm.
feeling. And they were able to help me. So I do understand that communication bit you were
Which
talking
is
about.
great.
Yeah, it helped me quite a lot.
Because you
I
did
did
have
visit the doctor
communication.
almost every week. I was there. I didn't care. I was shamelessly going back, but I got
Good.
help. I got help that
Good,
I
because it's your
needed.
health.
Yeah. And my health visitor was also very, very nice. You know, she was coming to check on me and things like that. But again, speaking with her will help her, know what is going on with me. You said something about, I've heard of women just carrying their baby and just leaving the baby somewhere and they don't even realize that they are mothers. That is the extreme. It is the extreme. Have you
Oh,
got anything you want to say to that? How we can
oh.
support
I
someone
mean,
like that and
I,
also
without
prevent the
knowing the
person
case in
doesn't get
detail.
there? Yeah. To just to catch it
So
on time.
sorry.
Yeah. Yeah. Did you catch that?
Yeah. So without knowing the case in detail, I think I caught some of it. So you said about there's some cases, severe cases, where moms would actually leave their baby somewhere, not
Mm-hmm.
realizing that they're a mother.
Mm-hmm.
So that to me sounds like a case of puerperal or postnatal psychosis. It
Wow.
is that far advanced that you're actually now in a psychotic state. You
Wow.
don't know what is real from what is not real. Now, I'm not a mental health specialist midwife, but that we do. So we have units in the UK. We have mother and baby units whereby when we know that someone is actually at that point at risk of suffering from severe postnatal health, they will be referred to a consultant psychiatrist. They'll have care from the midwife, the obstetrician. It's a multidisciplinary team approach, and they can go into these mother and baby units. So they're not separate. That's another thing. They're not separated from their baby, but they're in a place where they can get the care that they need. Because, as you said, it can't get to that point. And I wanted to draw something out. You said that when you had your baby, so many years ago, you noticed that you went you use yourself and you went to ask for help. Now
Mm-hmm.
imagine if you had leaned into the strong black woman and you didn't ask for help.
I
You
know.
said you were going to your GP every week and they helped you. So imagine if you didn't. And there are so many women, they do not ask for help. They just hold it in, and then things can get to the point where you now get to the psychotic. You don't know what is real, what is not real. You just want to escape reality. So I just wanted to refer back to that what you did there was absolutely right. Go and ask for help. And I must say, I know it's easier said than done, but when
Mhm.
the baby's sleeping, that's your time to sleep
I
as well, especially
know.
if you have help. lean into the help. When my sister had a baby, I literally took the baby's cot into my room. And I said to my sister, you go, get your sleep, and we will take turns in caring for the baby every other night. So when you have help, utilize that help. You don't need to check on the babies are stronger than we think.
Yeah.
Early infant syndrome, cot death, it is a risk of neonatal death. But as long as you follow the rules, placing the baby at the bottom of the cot, not having padding or whatever around you're reducing the risk factors. So we don't necessarily need to watch the babies as
Mm.
they breathe. So you did the right thing there, and I would encourage people to continue to do that.
Wow, fantastic. So I know we've discussed about knowing what to do and all of that stuff. But I also noticed that sometimes when in a new country, especially those that have
Mm-hmm.
just come into the country, what are the
Yes.
things that they are really entitled to? Because I know a lot of people, they're like, oh, my visa, I have no recourse to public fund and things like that. Is there anything you can throw light on there on how they can get more information on this?
Okay, so unfortunately, I'm not a specialist in terms of like migrant women and things like that. However, because we do have the NHS, one of the things I would say, and from the perspective where I come from as a midwife, when you go, the way the NHS works, you may get a bill at the end of it, but you don't get the bill at the start. So that is not preventing you from accessing health.
Mm,
So if you're in the country and you need medical help or you need maternal care, you have to go because this is your life at stake. A lot of people take it for granted.
mm,
They think that labor is fine, pregnancy is fine, but it's fine when everything goes well. But when there's a problem, the mother's life, the baby's life is at risk.
yeah,
So what I would say is anyone in that situation that feels like, oh, I don't know what I'm entitled to, my visa, my this, that comes later. That is secondary. Your
right.
life and your baby's life is primary. That's the
Mm,
principal thing. So you need to access care. So when you go to access care from a GP, for example, they're not going to ask you to pay upfront for your visa details. If you come into the hospital, you're bleeding, even if you're not bleeding, but you need to be, registered with care, they're not going to be asking you at that point for the bill or whatever. So the most important thing is your health and the baby's health. So
yeah.
your status should not stop you from accessing care.
Okay, right. This is so important. It's very, very important because I've heard of people saying they did not go to the hospital because of XYZ, because of my visa
Mm-mm.
status. Are you listening? We are in the UK, they don't do that. And even if the bill come, I'm sure there's an arrangement that you can come with them, arrange with them, and they'll be able to sort that. So please do not just live your life and put it in danger. And the work could have just taken a little bit of care. We extend into things that could potentially be very, very dangerous. Thank you so much, Olamide.
Correct.
Now, one more question I want to ask is that, with the what do you call it now? With the pregnancy, sometimes a lot of people have done all of these things we've spoken about, and then
Mm-hmm.
there was an issue. How could people follow up on it to ensure that, like you said, because there are hierarchy to these things on how to address things. How do they go through that if they have a grievance
Okay.
they want to raise?
So it depends on where you are. So say, and correct me if I don't get if I haven't got the question quite right, but say, for example, I was still in the pregnancy period, so
Mm,
antenatal period,
yeah.
and I was not happy with my midwife in the community. I felt
Mm,
like maybe the midwife is not listening to me,
mm,
etc. The first thing you would need to do is when you pregnancy, you're given a list of contact numbers. So you would be given like a list of the emergency triage number. You would
yeah.
also be given a contact number for the community midwives. So if I'm unhappy with my particular community midwife,
Yeah.
I would get so the community midwives, they work from a hub and they have a community midwife manager. And I
Yeah.
would get through to the community midwife manager to express my concerns.
Yeah.
So that's one of the ways I would do it if I was still in the antenatal period. The other thing I would say is about timeline. So, say for the NHS healthcare services, they have the timeline for grievances. I don't know exactly what they are, but say, for example, I contact the community manager and say, I'm not happy with my midwife. I don't feel like I'm being listened to. You need to know, what do you expect at the end of this conversation? Is it that you wish to go to a different hub? what are you expecting? So you kind of go with a solution, and you also have your expectations. So you would be saying something like, okay, what are my other options? Can I see another midwife? Is there another clinic that I can go to? And you would have a timeline. You would be saying to the manager, for example, when should I expect this change to occur? You don't leave it blank.
Yeah.
No one, the NHS isn't perfect. The managers aren't perfect. So you also have to, advocate for yourself. So say what you want, the intended outcome, and also include a timeline. So are there any other clinics I can go to? Can I go to the hospital instead? And when can this happen? Is it 1 week? Is it 2 weeks?
Mm.
That's if I'm in the antenatal period. If I was in labor at the hospital, and say that a midwife came into care for me, or say I've been on the antenatal ward, I'm having an induction, and
Yeah.
a midwife came to care for me, and I didn't like this midwife, I feel like I wasn't being listened to or whatever, then you can ask for who's coordinating. So there's always a coordinator in the hospital, and it doesn't stop with the coordinator. The coordinator, you don't need to worry about this, but there might be a band 6, but there will be a band 7, and there will be a band 8 as well.
Mm.
So if you feel like you're not being listened to at one step, you can go one step further.
Yeah.
If I mean, sometimes it can be trickier. Say I was
Mm.
in labor, and a woman and the midwife was looking after me, and it's been 2, 4, 5 hours, and I don't feel safe. I expect that woman to speak up. Why is it that you don't feel safe? And you can ask to speak to the coordinator of the shift. Tell them you don't feel safe with
Right.
wife. Now, this the NHS is imperfect. So you could at that point request a change in midwife, but because of the situation, it may be that there's no other midwife available. That might be
Mm.
possible. In which case, I would expect the coordinators to sort of take an interest, see what's happening, and support you until another midwife is available.
Yeah.
Alternatively, if another midwife is available, I would expect them to provide you with that other midwife.
Yeah.
There's also something called Martha's Rule that I didn't mention previously. Martha's Rule came about when, very sadly, an 11-year-old girl died in NHS services. So Martha's Rule is basically a team that are dedicated to giving a second opinion. So say you were in hospital, you were not happy with the midwife or with the obstetrician, you felt you needed a second rule, you could say, can I please apply Martha's Rule and have another team come and assess me?
Mm.
As I'm saying, none of these things are perfect, because in obstetrics, maternity, say there's two emergencies ongoing and we have two teams in the theaters, they're doing emergency cesarean sections or whatever. It
Yeah.
may be that there is no immediate obstetric team to attend, but on a good day, if they're not occupied, you can apply Martha's Rule and ask second opinion. So
Mm.
the point is, you don't have to feel stuck where you are. If you feel unsafe and you feel unheard, escalate to someone, tell them what you intend should happen,
Yeah.
and ask about the timelines as well.
Fantastic. Thank you so much. That's very valuable information. If we are to empower our people, we also have to give them the right information so that they can leverage on it, because ignorance
Yeah.
can be very, very costly sometimes.
Mm,
I just want to ask this. I don't know if you'll be able to speak on it, but I'll ask anyway. So, when a woman has been through miscarriage or a woman
mm.
has been through traumatic birthing experience, how can a woman request for counseling? Is it through the NHS or through the GP?
It's more likely to be through the GP. So, say a woman has gone through a traumatic birth, what should happen immediately after the birth? Let's use an example. Say a woman has gone through a bereavement
Mm.
of it could be a late fetal bereavement or a neonatal bereavement. What should happen is they should have a debrief within the hospital. So the debrief would typically include members of the multidisciplinary team, the obstetrician, the midwife, etc. So they would have that initially. Now with bereavement, we have specialist bereavement midwives.
Mm.
So that bereavement midwife is able to provide signposting and services
Yeah.
to the woman.
Right.
Um, on discharge, most of the counseling there is, like, you still have contact with the hospital, but most of the counseling is possibly likely through the GP.
Mm.
So with the GP, I mean, in the past few years, the GP, they've extended their services. So they have, talking therapies, they have
Yeah.
CBT.
Hmm.
So it depends on the kind of traumatic event. So in that kind of case, if it was a bereavement, I would expect input from the bereavement midwife for
Yeah.
a few weeks. And I would also expect input from the GP. If it's something like not a bereavement or maybe something that was just traumatic, you
Hmm.
may not have certain services within the hospital, in which case you would have to go via primary care, which is your GP.
Right, right. Fantastic. Okay, right. That's good. Now, to wrap this all up, thank you so much, Olamide. You,
Oh, can I just add one thing to
please,
that as well?
please, please.
I was gonna add occupational health. So a lot of people,
Uh-huh.
they don't always make use of occupational health services within their
Mm.
employment. So every employer is has a responsibility towards your well-being as well. So say a woman has gone through a traumatic birth or whatever, they can
Mhm.
also contact occupational health, which is usually a referral from their work manager to occupational health, and they could also access counseling
Oh.
services via that field as well.
Mm.
Sometimes counseling, you need to try different things and different
Mhm.
counselors or psychologists to
Yeah,
find what works for you. So you can also access counseling services via your employment.
right. Fantastic. That's good. So let's say a woman had issues after having the baby and they want to return to work. Can occupational therapists also help with that as well to
Occupational
see if
health, yes, they can.
yeah, to see if they need any adjustments,
Yeah,
reasonable
oh, of course.
adjustment at
That's
work.
yeah, that's what occupational health is all about. What reasonable adjustments do you require for you to be able to do your job properly? So that's what
Yeah.
occupational
So
health
when you're
is
coming
about.
from maternity leave, you can tap into that.
Of course, yes.
Aha.
Well, actually, what should happen is when you return from maternity leave, you should actually, I mean, every company is different, but you should actually have an occupational health referrer because your health is not what it was before you
Yeah.
left. So you should actually have a referrer to see that everything has gone back to normal. In our cases, when midwives come back to work,
Yeah.
they would have an occupational health referral. So that's
Right.
something you can tap into naturally postnatally.
Right. Okay, that's so interesting. That's such a good information.
Or even antenatally, if you have symphysis pubic disorder and you've got a
Yeah.
lot of pain in your pelvis and you find that, oh, you can't walk as much as you used to
Yeah.
before you were pregnant, you need the occupational health referral to see what adjustments can be made. It may be temporarily moving to a different part of your employment because you need to sit down more or
Yeah.
whatever. So you can tap into that at any point in your pregnancy, in your well.
Fantastic. Ah, Lamide, where were you when I needed it? I had pelvic pain after
Oh,
having my
wow.
first one, the second one. And because I was lifting her up, so the GP asked me, I went back again to my lovely GP, and then he referred me to what they call it now? Oh,
Physiotherapist?
physiotherapy, that's the one. He referred me and they showed me certain things I need to do and all of that. But I didn't know at work I could make reasonable adjustment because I was doing
Yes.
the job where I was walking around quite a
Reasonable
lot.
adjustment.
Right. Okay. I didn't know that. Right. The last but not the least question is for in order for us to prevent all of this, I'm very, very into positive psychology, whereby the preventative is better than the reactive,
Hmm.
right?
Hmm.
So, what are the things that a woman could do that will help to boost their mental health? It doesn't matter how small it is. Let's just those little things that you drop into your jar bucket and then it's to put holes into the stress bucket and just escalate it. What are
I
the
love
little
that.
things that it can do?
I mean, I guess this is now generic. So you're talking about women in general.
Women in general, or even a woman that is into, since we are talking about antenatal and a woman that is pregnant and all of that, yeah, what can we do?
Okay, so
Not that I'm
few
pregnant anyway, I'm just asking
things.
you.
Okay, I can be your midwife here. Healthcare and well-being is so important. I would say maybe sometimes what you need to do is sit and think about what are the things that make you feel lighter.
Mm,
What are the things that make you feel better? So you might not even know what those things, like I know for myself because I've had to do that exercise. So a good starting point would be, what are the things that make me feel like me? What are
mm,
the things that make me feel like I'm at my best? Is it going, sometimes you may, I'm going to make it a little bit more difficult, but you might know what those things are already. So if you know what those things are already, then you just basically need to make time for it.
mm,
We have to make time for these things. We can't say there's no time, because when you keep giving and giving to others, are you giving from an empty cup? So
Mm-hmm.
you have to feel self to be able to continue to do what you need to do. So
Mm,
I would say sometimes maybe it starts with an exercise. What are the things that I need to be me? Now, it may be that you don't know what those things are. So if
yeah.
you don't know what those things are, still do the exercise, except yours will be like, okay, I'm going to try different things. I'm going to try reading a book, joining a book club, and I'll see if that actually makes me feel better.
Mm,
If it doesn't, I'm going to try walking for 30 minutes in the evening or in the morning. I'm going to see how that makes me feel.
mm,
Okay, maybe that's not it. Is there something I've always wanted to do? Have I, do I not know how to swim and I've always wanted to learn how to swim? Okay, I'm going to find my local health club. I'm going to go there, learn how to swim.
mm,
Even if it means just sitting in the sauna, sit. So if sit with yourself and think about those things that you could do. If you don't know what those things are, try different things.
mm,
Ultimately, it's about what are the things that you need to do that keeps you you. I
mm,
know for me, I need to get my sleep. If I don't get good sleep, I'm not me. I'm not
mm,
me. I know I need to eat well. I know I need to try to get to the gym. When you're at the gym, it's so hard to find time for exercise. But when
yeah.
you're there, natural hormones and pheromones are released that make you
Yes.
feel good. So
Yes.
it's about what do I need basically for self care to be me? And it's tapping into those things and filling your own cup.
I love the way you answer that, Olamide. I really love it because what you've done, you've made it so personal
Mm.
without specifically dictating to us, do this, do that, do that. I love it because the question is, it's time for you to now go back and reflect and say, what are the things that I do that fill me with joy, that make me
Yes,
feel relaxed?
exactly.
For me, being in the nature, I'm just like a toddler. I'm just moving around. And I always tell I said the fresh air over there is different from
Mm.
the polluted one that you guys are just surrounding yourself with. There's just something about nature, the trees, the colors. I don't know. It's just like home to
I know
me.
what you mean. I love it as well.
Just going there and just seeing and
I'm going to
sitting
go for
down.
a walk after this. Yeah.
Yeah. I'm taking the kids to the park after this. So, yeah, just think about for some people, it might just be sitting down listening to good music.
Yeah.
So, go back, reflect,
Yes.
and start exploring until
Yeah.
you find things. For some people, you might love it, but it's not something you want to do again. So, every now
Mhm.
and then you dip in and dip out. Let's
We are
do
our
it.
biggest investments.
Yes, yes,
Some people they don't sleep well. They say they don't have time to sleep. But those things that you're putting your energy to, they will suffer ultimately if you don't
yeah.
invest in yourself.
Absolutely. Absolutely. So please just remember you are worth it. Now, the last question I normally ask guests is, Olamide, how do you remain authentic to yourself? What are the things that you do that keep Olamide authentic and grounded?
That's a big question. That is a very, very big question. Um, the first thing that comes, it's a big question because I'm guilty. It's easier for me to preach, and I also need to sit back and reflect and do that thing that you need to do, Ola.
Yeah.
But the first thing that came to my mind is faith. So I am a person of faith. I do
Mm,
have a belief in God, and see, many things change. People
yeah.
change,
Yes.
relationships change, the way that I feel change. I
Yeah.
might feel good in the morning, I might feel good in the evening, not feel good in the evening. So
Yeah.
things are always changing. But one thing that is always the same is that belief in God. When I say that belief in God, what I mean is actually that God doesn't change.
Yeah.
So for me, having something that doesn't change, that is always stable and the
Mm,
same, that helps me and brings me back to it keeps me grounded. I would say that's one of the key things.
mm,
The other things that make me help me be authentic is, you already asked about self-care, looking after yourself. When I'm able to truly look after myself, I don't believe it's selfish if I do things for myself. No, I'm
mm,
not a machine. I will not, when I do things that bring about self care and good well being for me, helps me. I know I function better.
yeah.
So I would say investing in myself also helps me stay grounded and being authentic to myself. Those are the two things I can think of.
Wow, I can relate. I can definitely relate. Thank you so much, Olamide, for your time. You have been an
Absolutely.
absolutely lovely and insightful
Thank you
guest.
so much. It's gone quickly. I didn't think it would go this
I
quick.
know. Right. Thank you so much for listening to us today. If I would love to hear from you. Don't just listen, please share with your family, your friends, and also comment below in the chat box what stood out for you and what are the things you're going to go away and implement right away. Until I come your way again, I remain Abisonia, your host. Thank you so much and God bless.